Guys, welcome back to the channel. And it was as if I had a little break, but I'm back and stronger right now. Okay, so if you've been watching this channel, I want to say a big thank you. If you've been liking, if you've been sharing, thank you so much. I am so grateful. Eshego, like I've always promised, I always have my questions and answers session. Today's question, I got this question from an individual, Miss B. So Miss B had told me that I had earlier on discussed about urinary tract infection and that she understood everything, but that the only confusion she has is that how does she collect the urine sample? Because the last time she did collect a urine sample, she was told she collected it wrongly. So this is a very, very common occurrence. I'm telling you, it's quite common. A lot of people get the wrong results because of poor collection. So definitely know that poor technique leads to poor results. So I want you guys to pay close attention so that you learn the right technique. Okay, so if you are going for a urine test, it could be a urinalysis or it could be a urine microscopy culture and sensitivity. Okay, so they need the purest form of your urine sample. When I mean purest form, they need to know that you collected it well, because if you don't collect it well, there are things that we call contaminants. Okay, so these contaminants will contaminate the result and it will lead to wrong result. Therefore, they will start treating you wrongly, and you see, you keep having this infection and nothing will change even after your visit to the hospital. So now I want to teach you how to collect the right thing. Okay, so I guess you guys are seeing this bottle now on the screen. This is the type of bottle that they always give you to use and collect your urine sample. It's called universal bottle. Okay, so now you are handed the universal urine bottle, and as a lady, you want to collect this sample, and people will be like, okay, what if I want to collect this sample? Maybe not in my house, I'm somewhere outside. Okay, so what you do is get a wipe, clean off that area, or if possible, if you can get small water to wash off that your area, that your bum area. Good. When you wash it off very well, then you can now spread your legs apart. Make sure you do this. Try and practice it after this video. Spread your legs apart, and then the first urine that comes out, if you're urinating, you have this tom 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 tom, then it will be like zzz, don't collect that tom tom tom. Don't collect it. Okay, so when it starts doing zzz, that's when it starts rushing very well, then you can collect that sample, and that's it. Okay, so let's go over it again. Clean off with a wipe. Some people say, wipes, is it the same thing with tissue? Please, tissues, it's been shown that tissue can also form a contaminant to your sample. So that is why I am very particular about saying wipes. Okay, so you can clean with wipes or you can wash off with water. Okay, somebody was asked, okay, so washing off with water, is it water and soap? No, you don't necessarily need soap. Okay, so just wash off with just water. Wash off that area with water. Spread your legs apart. Then when it starts coming out, when the urine starts coming out, it comes out with tum 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 tum. Don't collect that one that is just dripping like tum tum tum. Once it starts rushing like zzz, that's the one you collect, and that's it. Okay, then if you're a guy, same thing applies to you. Okay, if you want to urinate, once you bring out your stuff, you can clean with wipes or you can use water to wash off the area, and then you can now collect. Once you have gotten past that tom 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 stage, once it's rushing zzz, then you can collect. So somebody will now ask, why clean off? So we are trying to reduce the rate of contaminant. The commonest contaminant we have is Staphylococcus aureus, okay? And it's always on your skin. It's always on the skin of that area, your penis area, your vagina area. It is always on that area. So if you don't clean off well to reduce the rate, men are lucky that they have just the penis that is just, out there. But the ladies, you need to spread your legs apart, because if you close up your legs, this urine coming out will be touching the clitoris, it will be touching the labia and everything to be contaminated more. So spread the labia apart so that whatever that is coming out directly from the source and entering into your urine bottle, and it will reduce the rate of contamination, and then you have your clean, sterile, properly collected urine. Okay, urine sample. Then that is assuming if you're going for a urinalysis. If you're going for a urine microscopy culture and sensitivity, it is always advised that you take the first urine first urine you make in a day, that very first one, as you wake up from sleep, you're feeling very sleepy, just try, clean off your sleepy eyes. Make sure you do the same process like I had already described before, but this time around it's going to be the first urine that you pass in the morning. Okay guys, thank you so much for listening. I hope Miss B have able to answer your question, and I hope that from today onwards you're going to be having contaminant free urine samples. Okay, so thank you and see you guys later. Bye.